Alright guys, so we'll be looking at the classification of routes of drug administration. That's like which ways you can actually make a drug to actually get to a patient. So for the classification of routes of drug administration, we have the local action, alright, then we have systemic action. Local action could be like, okay, I have a burn on my hand, so I want a drug to just act around this burn. I can just apply it to the skin. But let me say systemic stuff now, I have like an infection in the body, so I want the drug to actually reach the whole part of the body. That's systemic stuff, you know. So drugs can be administered through different routes, and this is based on whether they act locally at the site or systemically by entering the blood and affecting the entire body. Now for the local action routes, so that these drugs, they exert their effect only at the site of administration without entering the system. They don't get to the whole of the body, just where you administer them. So let me say drugs like administered on the skin, that's topicals, inhalational, you know, ophthalmic routes, okay, that's eye drugs for local eye conditions like conjunctivitis. Otic route, that one is through the ear for ear infections. Intranasal route, that's nasal stuff, you know. Rectal and vaginal, like you're putting it like through anus or through the vagina, you know. So let me say if you are giving a drug to the whole system now, right? So the drugs is entering the blood system, traveling through the body to exert a wider effect. So things like oral routes, so this is the most common systemic routes, right? So you give it through the mouth down. Parenteral route, that's through the maybe intravenous, intramuscular, subcutaneous, you know. The sublingual or buccal routes, this one, drugs, they dissolve under the tongue inside the cheek for direct absorption into the bloodstream. Then transdermal routes, that one is basically drug patches. They release medication gradually into the circulation, like you just patch it on the skin, so it's releasing it just very small, very small, very small.